medicine.
So why don't we write legislation and get it
Yeah,
done?
get it done. Yes, exactly. Where's that stand? I mean, it makes sense.
We're just in the early stages of communicating
Oh, I see.
this.
You know, I go to some of the markets where they have the holistic or homeopathic medicine, and those places are jam-packed with people that want to, want to take care of their own health and get the medicines that they don't need to for the okay to get from a doctor. They can get them themselves.
Part of the issue is that people aren't aware of the cost of the loss of freedom until it hits either themselves or members of their family. Sure. Consider the drug Provenge. 30,000 men die every year from advanced prostate cancer. Now, Provenge is a very innovative cancer vaccine, and it got through all clinical testing. The FDA advisory panel voted 17-0, this is a safe drug, and 13-4 that it was an effective drug. Everyone assumed Provenge would automatically be approved. Now the FDA, for whatever reason, demanded an additional clinical trial, which would take 3 years. So 30,000 men times 3, 90,000 men denied freedom of choice. And I remember reading ads in the paper because these men joined to just take to the streets because of the loss of freedom. The ads were dysfunction at the FDA, cancer patients suffering and dying needlessly. Well, that didn't deter the FDA. They took their time. Eventually, Provenge was approved.
When you mentioned the other, also very fascinating is the fact if you did this, you're in a way creating your own set of guinea pigs about the efficacy of these drugs. And the reason I mention that is that there is a great deal of controversy about the way drugs are tested, in that you give placebos to half of the people, let's say, suffering from some stage of cancer, and the drug that's being tested to the other half. Well, if I were in that sample, I certainly wouldn't want to be in the placebo group. But would this be a way around that, in that don't you need a placebo group to then really test whether the drug is effective?
Well, randomized controlled trials scientifically is very, very sound. And we leave that process alone. The free-to-choose medicine would not interfere with ethical randomized controlled trials. By ethical is that knowledgeable doctors really don't know if the experimental drug is any better than the approved drug. Okay, where free-to-choose medicine would create a problem for the FDA's randomized trials is an unethical trial, where knowledgeable doctors pound the table that the not yet approved drug is vastly superior, and then they don't want to put their patients into a 50-50 lottery where some get the wonder drug and the other people get a placebo or a drug that doesn't work very well. And earlier this year, the New York Times had a series of fascinating articles, and there were two cousins, two young men that both came down with advanced melanoma, really almost a death sentence. And Roche has a drug, PLX 4032. Now that drug, by the way, you get tumors popping out all over your body. It's a terrible situation. PLX 4032 is shrinking these tumors all over the place. And so one cousin got lucky. They got in the clinical trial and they got what the cousin called the wonder drug. The other cousin got into the arm that got the approved drug. Now, that approved drug was approved 35 years ago. Highly toxic, no doctor wants to write a prescription for it. But this is how the current system works. And it's just, it's outrageous.
So what's the biggest reason the FDA will fight on this issue, the free-to-choose medicine?
Well, the FDA is a government bureaucracy. Have you ever seen a bureaucracy that will reform itself?
No, no.
Okay.
I mean, you have your work cut out for you for sure.
But right now, we don't have any concrete feedback as to the cost of this regulatory overload. I think free-to-choose medicine, we will see the benefits to people to get quicker access, and then the FDA will be pressured to become innovative, streamline its clinical testing, dramatically reduce the cost, and actually finally get lower prescription drug prices. But the FDA isn't going to willingly do that. Same way we now have one-day express mail from the post office. Yeah. How did we get that? Because of FedEx. Competition from FedEx forced the post office to become more streamlined in delivering a product.
I know it's interesting. In many cases, these people are taking their last breath and they can't, sign for themselves to get this drug that they want to have. And on a daily basis, I think some of the foods that we're ingesting are highly toxic, but they're approved by the FDA to be in, to be in our food, but it's different.
Not under the FDA
I understand
umbrella.
it's different, but it's still it kind of just is a common sense thing.
Well, see, the opportunity cost, which right now is somewhat invisible, and unless you're one of those people on death's doorstep, that if you believe medical innovation is going to accelerate in the future, which I do and I think most people do, then we're going to be in a situation where FDA-approved drugs are obsolete compared to the most innovative new drugs that are stuck moving at a snail's pace through clinical testing.
Well, it's not as if, though, Bart, you're dealing with a situation where you have very little support. It seems to make a whole lot of sense. And if you're dealing with the pharmaceutical industry, you're dealing with the political powerhouse. I could just imagine the lobbyists that they have in their trade associations and so on. Okay, I understand this book and you being on the show, spreading the word. The next step is, how do you change legislation? It seems to me that it would be fairly straightforward. Why don't you go to that next step?
We've just started to approach people in Congress and lay out the free to choose medicine.
Is it early enough? What's the reaction?
I just met with a few people a few weeks ago, but some keen interest, and I think we want to be working with Congress and also educating the public, which is what we're doing here right now, as so they really do have an opportunity to take control and get back control of medical decisions where they belong, with patients and doctors.
Well, I imagine it's not you doing it or you publishing the book or the show is not going to convince government or get the word there. Right. To write the legislation, maybe the show. Tim. You're right. If we could get it into the DC market,
that's right.
But if we can, if you can get this to the trade organizations or associations, pharmaceutical trade associations, it seems like that might be a path. I'm just wondering, in terms of a political strategy, whether you're working on that, how that would be done.
We are working on it very, very early stage right now. But if you think about the pharmaceutical industry, that if sky-high prescription drug prices, customers are not that happy. Moreover, there is a real risk that the future is price controls for the pharmaceutical industry. They need a new business model. I think getting back to the basics of providing high value to consumers is what free to choose medicine is about. That is the way forward for a different business model. And with that business model, economic resources would shift. Where would they shift? They would go to the firms most skilled in developing innovative medicine. And that's good for patients, for sure.
Do you think that, I guess it goes back to a question we asked earlier, but I'm just wondering if pharmaceutical companies that already have FDA-approved drugs would see this as a threat in terms of competition, that they have a monopoly on this product. It takes forever to get approval, and we benefit from that. Do you think that there will be some resistance from the industry itself?
Of course. All businessmen love competition, except when it affects themselves. What we're talking about here is a radical ratcheting up of innovation. So if you go back to those of us old enough to remember when AT&T and the regulated monopoly with telephones, what did we have? We had a choice: a black phone, a beige phone, and a white phone.
Yeah.
Okay.
Yeah.
Now what has happened with cell phones. So what you have is, with this fast-paced innovation, you have declining price and increasing quality and usability of the product. That's what we're talking about by bringing consumer choice and competition to the table here.
So basically a free market, libertarian, free-to-choose approach, and extending that to the use of pharmaceuticals and drugs.
I also think it's a common sense bipartisan approach when you get into the details.
Yeah.
I do too.
Well, all I know is
Getting government
if I needed a drug and I'm fighting some kind of disease or illness, I would want to do everything I can to fight it, right?
I'd want to be able to make my own decisions.
Exactly.
Right. Yeah.
Well, you want to be
Yeah.
free to choose.
I do.
Right? It's all about free to choose.
Absolutely.
But we're out of time. I applaud you. You don't
good
have any
luck.
personal stake in this financially. You're doing it as a good citizen, and I applaud you for it, and I wish you the best of luck.
Thanks.
Follow your dreams. Chapman University. Chemistry, physics, computational science, biology. Start doing research in your first year. Soar to new heights. The Schmid College of Science at Chapman University. Explore.